Hi, I'm Siobhán Fletcher and welcome to the latest edition of our newscast. Today we're talking healthcare and some rumoured cuts to Manx care services. The former health minister says government is essentially holding a gun to the head of the Manx people by sanctioning the supposed cuts. I sat down with Ramsey MHK Lawrie Hooper. Here's that interview in full. So, if you could just introduce yourself for me.
Yes, Lawrie Hooper, member of the House Keys for Ramsey.
Perfect. Okay, so just to set the scene here a little bit. So Douglas East MHK Joni Farragher tabled an urgent question ahead of this week's House of Keys sitting about whether elective surgeries were being reduced. She wanted to ask the DHSC if any other cuts to services were being proposed or planned. It came after Manx Care and the department renegotiated a pay deal with doctors last week. That was on Tuesday, the 21st of January, who were threatening to walk out. That deal has been accepted by the BM members today being Wednesday. When that deal was announced in Tynwald last week, the health minister told members she was not aware of any planned cuts by Manx Care to pay for it. You told your replacement her answers didn't stack up. Why then are you under the impression that cuts have been made but not announced?
So, off the back of that debate, obviously, the answers we were given didn't really stack up around the funding. Following that, we started to hear, we MHKs, I'm not the only one here, started to hear noise from constituents and seeing stuff being posted on social media about cuts that were being made. So people, surgical lists being cancelled, or people who've been sent across being told by hospitals across, sorry, we can't do your surgery. So that obviously is what I think prompted the urgent question. Ms Farragher must have had similar kinds of contacts around that. Obviously then we didn't get the chance to have that question answered because the health minister wasn't present in the chamber. She was unfortunately unwell. But what was really worrying is no one else in government was able to answer. So there wasn't, normally when a minister's not there, a department member could step in or another minister would step in. But in this case, nobody was willing to step in and answer the question. That sends a red flag straight up when that happens. And because the noise hadn't gone away, obviously I started to post. I posted them on social media myself saying, look, I'm hearing this stuff coming in from various quarters. I need some first-hand information. I don't want to just rely on rumour and on anecdotes. If anyone's had this happen to them, get in touch. That's happened. So my phone has been blowing up a little bit. I've had phone conversations with people, emails, the works, about people telling me what's actually happening to them on the ground. So I no longer suspect cuts are happening. I have direct first-hand communication from people telling me things have been cancelled. So they've been told a variety of things. So, for example, I've had people telling me that hospitals in the UK are telling them that they can't book Manx patients in and they're going to have to wait until the new financial year. Even though they've got slots, they could accept patients. I've heard people tell me that no patients from the end of January are going to be accepted. I've seen information that suggests that surgeons on the Isle of Man have had their lists cancelled and that some surgeons may have lost all of their surgical lists, and that at the moment the proposal is that they're only going to be accepting non-cancer, cancer or urgent surgeries. So anything that's non-cancer, not urgent, could be cancelled. And interestingly, I've seen something which talks about they will only take true day cases. So if it's a day case, you're in and out in the same day. So actually, you won't be able to go in and have an operation if you may need to stay overnight. Mm-hmm. So lots of this noise coming out. The challenge is trying to triangulate some of it. So I have reached out to Manx Care this morning and said, look, this is what I'm hearing. Someone needs to tell us what's going on here, because the minister has said there will be no cuts. Evidently, that wasn't entirely accurate. There are definitely cuts happening because patients and medics and staff are all talking about this. We know this is going on. But the government is absent. They're missing in action on this. We haven't heard anything from them other than for them to deny that any cuts were coming. The other thing that makes me worried about this is I am aware that the week before the Tynwald sitting, a press release was sent out under embargo to news organisations, which advised them that cuts were coming. So even at the point when we were in Tynwald talking about these things, the minister must have been aware that this had gone out and that these cuts were coming. So the longer we wait, the more information is coming in that this is happening, contrary to what Tynwald has been told. And that raises serious alarm bells.
So just to sort of completely set it in stone here, so have Manx politicians had any briefings from Manx Care or the DHSC about potential cuts?
No, we've had absolutely nothing. The last time we talked about cuts, the council ministers advised Tynwald that they had thrown all the cuts back to Manx Care. They'd rejected all of them, apart from a few things which they'd listed to us at the time. And since then, the minister has refused to comment on cuts up until last week, where she confirmed to Tynwald that no cuts were coming. She wasn't aware of any cuts. We didn't need to worry about that. There were no cuts happening. So no, we haven't had any information from it. Other than, like I say, Ms Farragher tabled that urgent question, and I think we were hoping we would get an answer either on the floor, obviously, and then when it was apparent that the minister wasn't going to be present, I think a number of us thought we might get something circulated, or we were expecting a press release. But no, we haven't had anything, which makes it even more frustrating that I know that they told the media, but are refusing to tell Tynwald, and are refusing to allow the media to use the information they've been given. There is something going on here, and government just doesn't want to talk about it.
Yeah, I think just to sort of clarify for listeners, I mean, in terms of from the journalistic side, when we get, as you know, when we get any embargoed press releases, it's embargoed, so we cannot release that information. It's not a big cover up, it's not anything like that. It's just that usually we get it and maybe we have a briefing, or you saw in the COVID days we had public briefings where we were on the radio, and we've been given an indefinite embargo on that. I think our question, and speaking from the media then, to go back on that, our confusion has been why no politicians have used parliamentary sort of privilege to bring it up in Tynwald or Keys. But you're saying that opportunity was going to be this week.
And that's the point. So we tried to do that. And the government, like I say, when the minister wasn't there, normally somebody else would step in, especially on a matter like this that was urgent, that is of national importance, that obviously there's a lot of concern about, something that is really going to impact people. But no one else was willing to answer the question. And the government didn't put anyone else forward. So the opportunity we had evaporated in front of us, and that really pulled the rug, I think, out from some of us who were hoping to have this conversation in public in Parliament. We suddenly weren't able to do that, and normally when that happens, something like this, I would have thought there would have been an email, a note, a press statement, something that informs us what's going on, even if it was just a statement to say, sorry, I think you've misunderstood, don't worry, it isn't as bad as all that. But actually that hasn't happened, and the more I'm hearing from people, the more people that are emailing or messaging or calling, it does feel like it's as bad as it's made out to be. And I don't understand why the government isn't standing up and being honest with people about this. It's clearly, you can't keep a secret on the Isle of Man at the best of times, but something like this is definitely not going to go away quietly.
And you mentioned, like, in the House of Keys this week, when that question was pulled as the health minister wasn't there, it was kind of said that the answer would come in a written question. That's now been tabled by Ms Farragher into another oral question next week. But I guess there seems to be this communication void between what members of the public think and some MHKs like you are starting to say versus what Manx Care are saying nothing. Do you think then that that's a problem that's making this bigger beast for especially the public who are like, what is going on?
Absolutely. So I've had people that have talked to me about their procedures or what have you being cancelled, and they've called Manx Care to try and get some information, and they've been told we don't have any information, we can't comment, and that's worrying as well, because there are people on the ground, actually patients, being told in one case by a UK hospital saying, sorry, we've had to cancel your surgery, or we can't rebook it, we can't book it in before the new financial year, and Manx Care said, well, we can't tell you anything about it. And that must be really frustrating for people actually who are waiting for these surgeries in the first place. So the whole thing is being made impossible by the fact government aren't commenting, and so I can understand why Manx Care can't say anything, because they may have been given the same instruction as you guys. They may have been told, actually, then this needs to be handled in the right way, there needs to be a proper communications approach. So obviously they're probably trying to do what they think is in line with their instructions, and suddenly this has all fallen down because the government seems unable to find someone who wants to be responsible for announcing to the public that they have in fact cut services.
You and Ms Farragher are two politicians who are actively discussing this, like we are right now. Everyone else seems to be silent, but we've got some normally pretty vocal backbenchers. Why do you think that is? Why do you think that there's not more MHKs actually vocalising concerns right now?
So I don't know. If I'm honest, I suspect it's because it's hard to know what's going on without seeing anything. So if all you've got is people talking to you and messages coming through, it's quite difficult sometimes to piece everything together. I think myself and Ms Farragher, having been in the health department, maybe have a bit more of a background, so we kind of a bit more comfortable saying it. But I've had conversations with a number of other members who are also hearing things and sharing information. So I had one member tell me that they'd heard that actually it was the North West Hospitals thing was because Manx Care had written to them instructing them not to treat patients. So we all are aware this stuff is going on. We're all getting our own little bits of the puzzle. But what we really need is the ability for us to question government on that, which government is flat out refused us by not allowing someone to answer those questions on Tuesday. And because government hasn't said anything, it's really hard for anyone to engage in that conversation to find out what's really going on.
I mean, you mentioned the background in the health department there. I think, surely, is this kind of, in a way, are you grandstanding slightly from a position of knowledge? Because the picture can't have changed much since you were a minister. I mean, surely it could be argued some of these issues were legacy issues.
No, the position has changed substantially. So one of the reasons I resigned from the post was because back in October I went to the Council of Ministers and I said to them very explicitly, you've got two choices. You either need to accept you need to fund healthcare properly, or Manx Care are going to end up having to cut services, because that's where they're at. They're at the stage where they've done pretty much everything they can to make these savings quickly. But if you want these savings to be made quickly and at the level that you're talking about, so tens of millions, and you want them to happen now, the only way to do that is to affect patients. And I told the Council of Ministers I wouldn't do that. I flat out refused. And that's one of the reasons I left, because I did not get any support from them around that position. And so this was obviously inevitable in some ways, but I was kind of hoping that after the chief had gone in himself and seen some of the challenges, his position might have shifted. I was hoping that given a little bit of time, maybe with someone else at the head of the service politically, that the ministers would have shifted their views, but obviously not. So no, this is something that really should not be happening, but is. And if government has made a decision to cut services to affect patients, they should at least have the decency and the bravery to stand up and admit it.
In fairness, to sort of throw something at you that's happened since you were health minister, the doctors' sort of situation. I mean, we, like I said, mentioned at the top of this interview, the threat of strike action. Now there's been an offer on the table. A lot of people in the public's perception of that's going to be, so there's money to pay for a pay rise, but my surgery's getting cut, or my mum or my nan's surgery's getting cut. What if you were health minister? What would your message have been in that, if that scenario had been sort of thrown on your lap?
I think you're right. I think it's really hard to justify in the same week as you're offering substantial amounts of money to doctors to also be saying, but we're going to cut services to patients. And it may be that the two things aren't directly connected. I'm convinced that they are. Going forwards, they must be. But it isn't something that people find easy to accept. I've had a few conversations with people only today who've made that exact point, that they don't understand how on the one hand their government is willing to give doctors an 8% pay rise, but is at the same time cancelling the work those doctors are doing. And to be honest, I would imagine that a lot of those doctors are very frustrated themselves, being told, sorry, we can't afford for you to treat patients right now, so we're going to start cancelling surgical lists or stopping. I can't imagine the position that they're in, and I wouldn't want people to get the wrong impression here. It's not their fault. They're not the ones leading the charge on this. Doctors deserve to be paid fairly, and government should be the ones stepping up and making sure they're funding the service to fund salaries properly, but also to fund treatments properly. It's insane, the position that we're in right now.
Yeah, it's like those two issues have kind of been unfairly compounded into one.
Exactly.
Do you think then... Do you think it's ironic that Manx Care has spent millions of pounds attempting to reduce waiting lists by engaging private contractors like Synaptic to sort of come in and carry out operations, but now appears to be cancelling its own procedures, those being carried out in the UK, to save that money? Like, can that be right, that you've basically tackled waiting lists just to ramp them back up again? No.
So one of the original commitments that was made when we went out and sought the funding to do that work was that it would be a sustainable reduction in waiting lists, because we couldn't have a situation where you're doing these list reduction initiatives every 12 months, throwing more money at the problem. And I think if at the time we did that, we believed that it wasn't going to be sustainable, I would never have gone and asked him for that funding, and I'm sure the previous health minister wouldn't either. But the reality is, because Council of Ministers seems to be making these kind of short-sighted decisions, and it's very chaotic at the minute because no one knows what's going on and no one wants to stand up and be accountable and responsible for it. Actually, it's impossible to deal with this. And I think you've said is it ironic? I think it's criminal actually. The Council of Ministers started off with a long-term plan to help improve the health service and reduce waiting lists, and when the crunch time has come, they've turned around and gone, actually, no, we're not committed to that anymore. And they've almost pulled the rug out from under their own feet. They're starting to undo a lot of the good work that has been done, and it really worries me that that's happening now. What's going to happen with next year's budget? It's going to be the same issue. Are they actually going to start undoing a lot of the good work they've done because they're not willing to stay committed to that long-term plan?
And sort of speaking of the budget, which obviously is coming up soon, people are currently paying more for their health service after the tax increase last year, which was promised that it was going to be temporary. Then, they're paying more than ever before. Arguably, the service now, some would argue, is in a worse place than before that tax hike came in. How is that fair?
I think that's a fair comment. My view is I think the service is a lot better than it was 5 years ago. Things have definitely got better, but the only reason things have got better is because of that sustained level of investment and that sustained commitment. And it almost feels like government is saying, we're not doing that anymore. And so what you are going to start seeing is a slide backwards. And again, I think that's the wrong approach. I don't think that's the right thing to do. But ultimately, the only way you can challenge that is if government actually has the courage to stand up and be honest about what it wants to do. Whereas what we're hearing from government is they're making all the right noises, telling us they're doing the right thing, but then on the ground they're doing exactly the opposite. And that there's no way of dealing with a government that isn't prepared to be honest with the public.
And you're kind of coming at it from an interesting place because you're a former health minister, so you've seen the conversations with Manx Care, you've seen the conversations in Comyn. I suppose, so, I mean, your clear message that I'm getting from you right now, Lawrie, is that basically these cuts are coming from a Comyn and like a government level rather than Manx Care potentially.
I have to assume that's the case, and from my experience, Manx Care have always said they don't want to do anything that will affect patients. That's been their position since day one, and it can only be because of the directions they've had from council ministers saying you've got to save money. That's the only reason that they will be doing these things, is because in the timescale available, the only way to save any significant amount of money is essentially to stop treating people, and that's what we're seeing happen now. As people are being told, we're not going to treat you, sorry, you'll have to wait. And that's the only real way you can make meaningful savings quickly. And that's something council ministers don't seem willing to accept, that yes, you can make savings, and Manx Care will openly admit they could do better, but it takes time. But if you're not willing to give them the time, you're going to start doing things that impact on patients. So Manx Care will have inevitably come up with a list of things that could be done. I find it very hard to believe they would have done these things without some sort of political sign-off and political approval. So yes, I can only believe that this is sort of as a result of that approach that's being taken by the Chief Minister, by Council, to tell Manx Care, you have to cut, you have to save money, even though we know they're already going to be £15 million over budget, is the latest number I think that I've seen floating around. If it was me and I was given the choice between being 15 or 15.5 million over budget, knowing that the difference was not treating patients, I think I'd be going back to Treasury and saying, look guys, I think we just need to extend the overdraft a little bit more. But obviously my position is not the same position that the Council of Ministers holds. If they're willing to see patients not be treated, if they're willing to say, no, you have to cut services, you have to save money, and that's the most important thing, then that's a very different environment to the one that I left.
I suppose back in October, right before you left, and we had that first raft of cuts from Manx Care, which Theresa Cope at the time described as unpalatable decisions. I remember speaking to her at that point. The current health minister, when she was a backbencher, Claire Christian, said that Manx Care was holding a gun to the head of government. Do you now then think that government is holding a gun to the head of Manx Care?
I think it's worse than that, actually. I think government is essentially holding a gun to the heads of Manx people at this point, because they must have told Manx Care, you have to save money. There's no way Manx Care would willingly go and make these cuts. And ultimately, the people that will lose out are going to be residents. And the fact that they're not telling us about it, that's the bit that I find impossible. And if this is all coming now, during the same cycle as budget preparations and everything else that's going on, and the government is hiding from the truth, actually, are they essentially saying, well, we're doing this and we don't really care what you think, we don't really care about talking to the public and engaging with the public and telling the public what's going on? They won't even tell us politicians what's going on. They won't tell Tynwald what's going on. I don't understand why they're doing it. I don't understand why they aren't just standing up and saying, we've made a decision because we think it's the right thing to do. Others, like myself, will disagree with them. That's the nature of democracy. But how can people fight back against a decision or fight back against something when they're not being told anything in the first place?
Perfect. I mean, I could speak to you for ages about this. I mean, there's questions floating around about, are we heading towards privatisation? That's a whole other can of worms. But is there anything else major you think we've missed that you want to talk about?
You mentioned there about heading towards privatisation, and the government will deny this till they're blue in the face. But I've had people talk to me and tell me that they've been told quite explicitly, I can't treat you. If you want treatment before the next, and you're not even going to be guaranteed in the next financial year, but if you want treatment before the next financial year, you are going to have to go private. And if that's what people are hearing, if that's what people are being told, then yes, the government is essentially forcing people to look at a private solution, because they're being told, we're not going to fund you. Not just that there'll be a delay, not just there'll be a waiting list, but people are being explicitly told, we're not going to be doing that procedure on you this year. We'll have to wait and see what next year's budget looks like. Of course that's forcing privatisation on people. Whichever way the government chooses to spin it, that's what's happening.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.